welcome to LE Live. I'm Dr. Mike, and this is
Dr. Crystal.
You got some of the winter blues?
Somebody's dealing with it out there. We know that it's cloudy. There's snowstorms all over the place.
It makes it tough. I think in general, wintertime blues, a lot of people experience that. But we're going to be talking about something a little more, I think, specific, which is called seasonal affective disorder, right?
Yes, and we'll go into the how it's diagnosed a little bit later, but it's something that's very prevalent. Estimated that millions of Americans experience seasonal affective disorder. They may not know it. They may not have the proper diagnosis, but they know that something's wrong, and they're having these symptoms, and there are things that you can do about it.
So on today's show, we're going to be talking about seasonal affective disorder or depression, why it occurs, and what you can do about it. Let's talk about what it actually is. We know that, generally speaking, it's a form of depression that seems to kick in for people during the winter months. Like, it's more common for them to feel the depression during winter than it is, say, during summer.
Absolutely. And it is a subtype of major depressive disorder or bipolar disorder. And this is according to the latest DSM, or Diagnostic Statistical Manual of Mental Disorders.
Yeah, and the further north you live in the United States, the greater the risk of seasonal affective disorder, and it occurs most often in women.
Yes, and when you look at the diagnosis, we kind of hinted to this a moment ago, seasonal depression for at least 2 years and having more seasons of depression than seasons without depression.
Yeah.
So this isn't, I'm just kind of feeling a little down right now.
Yeah, and I'm glad you just brought that up. This is it's important to understand that there's a distinction between feeling a little blue, I know we started the show that way, whatever, than a true diagnosis of seasonal affective disorder. So just keep that in mind. As a matter of fact, if you look at the symptoms of depression, we have a list here. These come right from what's called the Diagnostic and Statistical Manual. This is what a lot of your psychiatrists and psychologists are going to use to diagnose. And there's a list of symptoms. And I don't think we have the full list here. I think this is a partial list. Correct. But if I'm not mistaken, I think it's 4 or 5 of these have to occur during winter months for at least 2 years. Right.
And this is depressed mood, of course.
Obviously, at the top, right.
Loss of interest in daily activities, thoughts of death, disturbed sleep, fatigue, difficulty concentrating or making decisions, and change in appetite or even a change in activity or desire for the activity. And
you can see how it's important it is to really have multiple of these symptoms before you before a doctor will diagnose that, because anybody at any time can be like, my appetite's changed a little for whatever, right? Or I'm just not sleeping well all of a sudden. Right. Everybody goes through that kind of stuff. So it's really a collection of these symptoms. 4 or 5 of them have to be identified for that 2-year period. And it is kind of, I guess when you think about it then too, it's almost like it's cycling. Maybe this is why it's a subset of bipolar, they say a little bit, because you have some of these symptoms, you meet that criteria during the winter, you get better in the summer, next winter it happens again. So you are kind of following that cyclic flow.
Yes.
A little bit.
And so now the question is, what's
going on?
What's going on with the cyclic flow?
The cyclic flow.
Well, we can say this. We do know that it's more common in people living farther north.
Farther north, yep. Women, we said that.
Right. There are shorter daylight hours in the winter. And then there's a connection between the daylight and the production of serotonin.
Of serotonin, yeah. I mean, essentially, there's less. It's kind of, when I think about it, okay, let me just say the way I think about it. I don't know if this is 100% right, whatever.
Okay.
But it's like, when it's dark, melatonin's high, serotonin's low. People may forget that serotonin and melatonin are related, right? And they're kind of opposite. And so, at night, think about when you're sleeping, right? Melatonin's high. Serotonin's just kind of hanging in the background there, right? But when you wake up, cortisol gets up, you get moving, serotonin comes up, melatonin goes down. But if you're in less daylight, it's cloudy, it's darker, it's getting darker early, it's darker inside. I think everything gets confused, right? And so
your
serotonin
circadian
struggles.
rhythms
Yeah.
is kind of thrown off.
Yeah, and so serotonin struggles a little bit. And that may be
And that
one of the
can
reasons.
impact mood.
We do know that another big reason would be low vitamin D. Let's talk about
We
that.
do know that.
Low vitamin
right?
D.
Vitamin D is naturally produced from exposure to sunlight, UV light.
Yeah.
And during the winter months, less daylight, now less production of vitamin D.
Right.
Potentially.
Yeah, and again, it's whatever's going on is multifaceted. There's a
Yeah.
lot of things happening. There's even maybe I've identified some genes that could be involved with this as well. And so when we talk about, we're going to focus a lot on vitamin D because it is readily available. Right? Let's be honest. I mean, we should focus on it. But just keep in mind, there's still a lot of research that needs to be done.
Yeah.
We're not saying this is a cause-effect. Again, there's multiple things happening.
Yeah.
Low vitamin D, though, does seem to maybe be playing a role.
Well, and we know that vitamin D levels kind of fluctuate seasonally.
Yeah.
And specifically, I think you talked about the 34th.
I missed it. Yeah, I got it right here.
Yeah, okay.
Can we show that now?
Yes.
Let's Robson throw that up. So what you're going to see here, you're going to see a map of the United States, right? There it is. If you look from the West Coast to the East Coast, cut through Dallas, that straight line is generally going to be the 34th parallel. It may not be perfect. It's close. Anybody above that line during winter months, you're pretty much not going to make enough vitamin D by sun. So that's a
34th parallel.
That's a lot of people in this country not making much vitamin D during winter months.
Yeah, and that's a problem. The research is showing that lower vitamin D levels have been observed in depressed patients compared to control. So we are seeing some connection. You know, we don't quite have a cause effect. This is more of an association here that
Yeah,
we're
of course.
seeing,
That's what. Yeah, make
seeing
sure
the
that's
connection.
We got to make sure that really resonates.
But we also know that vitamin D in the central nervous system affects the production of serotonin, back to serotonin,
go.
as well as dopamine. Both of these neurotransmitters or brain chemicals are involved with supporting a healthy mood.
Yeah. So again, there's a lot of things going on here.
Yeah.
Right. It is interesting though when you look at these different hormones, and we talked about them, and then you realize vitamin D plays a role in how these hormones are kind of managed.
Vitamin D, it does it all.
It's all
in the body.
Well, I mean, how many times have I said this? There is I think, pretty much a receptor for vitamin D on every cell line. What I mean by that is kidney, brain, heart, bone. I mean, right? It goes on and
Goes
on.
on and on.
Yeah. And so it makes sense that vitamin D is playing such a big role in all of this. And so that's kind of why, so overall, you're up north, there's less sunlight. The angle of the sun is just not hitting right to make the vitamin D as much, especially if you're above that 34th parallel. Other risk factors, genes, females, all that kind of stuff. And so here we are, where millions of Americans suffering from seasonal affective disorder. What are we going to do?
Well, I think that, one, seek professional help.
Thank you for saying that.
Get a diagnosis. Don't
Yeah.
diagnose yourself. Because again,
Dr.
with
Google.
it being a subtype of a major depressive disorders, you need to see a health professional.
Yeah, for sure. And
That's
don't,
number one.
And if you really feel it, do it. Like, it's okay.
Yeah.
We gotta make this okay. We really need to think of
destigmatize.
We do. We need to think of mental health in the same way you think of a broken arm.
Yes.
You break your arm, what are you going to do? Immediately you're going to the emergency room. There's not even a question. If you're having some of these symptoms, there shouldn't be a question.
Yeah, just get some professional help. That's number one. Number two, test your vitamin D levels.
Oh, there you go. That's a good one.
Why not?
It's a simple blood test. It's cheap. And you'll get an idea of where you're at with vitamin D and whether I need to be upping whatever I'm doing, whether that's through food or add-ins. Yeah. Do I need to up it or am I good?
Right. And we see that vitamin D, and we have a couple of studies to highlight because, we don't have it just with seasonal affective disorder, just studies solely in individuals experiencing that. We don't have that, but we do have data with vitamin D with depression.
With depression in general.
In general.
Right. Yeah, yeah. I want to go back to seeing a professional.
Oh, okay. You like that part, huh?
I have kind of a soapbox thing.
Okay, let's hear it.
Because
Dr. Mike's on his soapbox.
And listen, it's a wobbly soapbox. You know how everybody, I shouldn't say everybody, but most people do have a primary care doctor, right? They see them once a year. I mean, maybe if you're younger, once every couple of years. As you get older, trust me, warning lights go off all over the place. Robson,
are you in every 3 months, Dr. Mike?
I got to tell you, hitting my mid-50s, I have seen the doctor more probably in the last few years than I did most of my whole life. Anyways, that's not my soapbox.
A different soapbox.
Focus me. All right. Here's my thing, though. I think everybody should also have a therapist. I think insurance companies should start thinking of mental health therapy as primary care, and everybody should have a therapist, and they should, even if you're feeling great, you see them once a year just to talk.
I love it. So I sent something to my family and friends, someone speaking on this idea and this philosophy, and you think of it as self-care. It's like I do it because I deserve it. I'm going to treat myself to a conversation with a health professional, and I'm going to go as often as you need.
At least once a year. And I'm going to make a prediction. There are people right now listening to that thinking to themselves, but I get it. Yeah, I'm for therapy if you need it. I just don't think I need to go and talk if I'm feeling fine. I guarantee if you go see your therapist once a year, just once, and you just talk, even if you're feeling great, all kinds of things are going to come out.
I know.
That's my prediction. And that doesn't mean those things are causing major depression. It doesn't mean they're linked to I'm not saying any of that.
Right.
It's so... I'm off my soapbox.
Okay.
I think I made my point.
But I think it's a very good point, and I appreciate you. I wouldn't call it a soapbox, but I think you brought out something that's valuable to. Hopefully, it's valuable to you who's watching and listening, because we have to reframe how we think about
100%
therapy.
100%. All right, back to what we were talking about. That's a live show for you. Let's go over these studies with vitamin D. Let's look at that first one.
Any form of depression.
Any form of depression, anytime vitamin D was studied.
So 235 adolescents with any form of depression.
Oh, okay, very good.
One thing that we saw about this that were the different doses of vitamin D. So they received, one group, 2,250 IUs of D3. A control group received 250 IUs. This was for 9 weeks. At the end of the trial, the participants who received the higher dose had significant improvement on their depression scores, while the group that received the lower dose experienced a non-significant increase.
Yeah. So vitamin D is playing a role here in helping people feel better.
We do know, but you have to me, what stands out here is dosing. Because
dosing.
We'll talk about what we think is the best dose to take.
Imagine taking this same study, and even if it's not adolescents, adults, whatever, right? But same basic study, and instead of just having a one-for-all dose for everyone, what if you actually looked at blood levels? And from blood levels, you came up with dosing regimens for each individual person. Now, I know that's crazy. That costs too much. That's why they don't do stuff like that. But that's the point of the blood testing, because when you really look at this, you might think, okay, well, about 2,000 units is good for me. It might not be near enough for you.
It's not enough for me. I'll tell you that.
It's not enough for me either.
So
Okay, so that was study number 1. Then we have another study with 46 patients with major depressive disorder. Again, this is not necessarily seasonal affective, but remember, major depression has some of those same symptoms. It's kind of the same criteria. Seasonal affective is a subset of that.
Yeah.
That just happens in the seasons with that cycle. Okay, so these were major depressive order patients randomized into groups that received an antidepressant treatment combined with vitamin D, 1,600 units, or a placebo for 7 months. What do you think happened?
So while both groups improved, because remember, this was combined
With an
antidepressant treatment.
So everybody was on a drug.
Right.
Yeah.
Those in the vitamin D group whose serum vitamin D levels increased had greater improvements in depression and anxiety. So that goes back to us, they obviously measured the vitamin D levels and saw the vitamin D levels increase.
Yeah, and that's kind of like the proof of the concept. That taking the add-in vitamin D is boosting levels. Now, what's the clinical result of that?
Improvement in depression
There you go.
and anxiety.
It's completing that whole story now, which is what we really like about these kind of studies. I also like this too because, again, it goes back to see a professional. And listen, if you need an antidepressant, if that's the decision and you think it's best for you and your doctor agrees, no stigma. Take it. Listen, I've seen tons of friends and family members get significantly better on a drug.
Yes, and vitamin D is just another tool.
Yeah. So there you go. I love those 2 studies, and I think it does go back and it helps us to answer, because this is the common question in Google land, right? Remember, we follow you guys. Well, we don't follow you guys. Somebody follows you. That's how we know all this stuff. We don't personally. But on Google, a lot of people are asking, Doctor, let me just ask you.
Yeah.
Here's the question. How much vitamin D3 should I take in the winter?
Ooh, that's a good question. In the winter. So I kind of like to say, 1, lab testing.
Lab test.
But in general, a good starting dose is really about 5,000 international units.
You're gonna get in trouble.
I am, and I don't care. That's and I'm going to tell you, this is just from my clinical experience, looking at labs, hundreds upon hundreds of labs, talking to people and seeing how much vitamin D they're taking and seeing how those labs are moving, with retesting.
Yeah.
And really,
it's we're not taking enough.
And it's just one. And I always say, okay, how are you taking it? Are you taking it with food? Is it a fatty meal?
Of course, you want to review all that stuff for sure. Are you actually taking it? Are you compliant? Remember, if you're not taking it, it ain't gonna do nothing.
You have to be consistent. So all of those factor in. But yeah, that's the dose that seemed to be a good starter.
And again, it still always goes back to blood level. That's really what's, if you're out on 5,000, 3 months later, check your level. Where are you at? Are you nice and optimized? Great. Maybe you're not. Maybe you're a little too high. You can bring it down. That's the power of knowing the number.
You don't want to take it without testing. That point blank period. If you're taking it, let your doctor know you're taking it. I tell my primary care physician, he tests the last time I tested. He said, okay, cut back on your vitamin D.
Bring it down a little. You were like,
cut it back a little bit. We won't go into the circumstances, but I was taking much more than 5,000, probably more like 10. So he said, bring it back, because more is not always better.
Yeah.
So that's important to understand.
I'm at 5,000 units every day, fatty meal, and I have a nice optimal blood level. We look for, in case they want to know, is it 50 to 80 nanograms per mil? The vitamin D is tested in nanograms per mil. That's the units. So you want to see 50 to 80 I think my last one was like 79 or
Yeah.
something.
My last one, I brought it down just to give you an update. I actually stopped my vitamin D for about 3 months, came back, retested. It was down to 60, but I was over 100. You don't want to be
Yeah, you got to be
that high.
So that's why testing can be so powerful, and that's really what's going to help you, your doctor, your nutritionist, kind of come up with where you should be on a daily basis. But people ask the question, well, how much should I take in the winter? I mean, number one, you should be taking it all year long.
Yeah, that was the original question.
Yeah, you should be taking it all year long. You should know your level. And here's the thing, if you notice you're a little low, maybe in that range you're at 50, 45, 50, and it's wintertime, okay, maybe you bump it up a little bit. Have that conversation with your doctor.
Yeah.
Love this.
And it all depends on, if you're outdoors in the summer, then maybe, again, test and you may scale it back. But I typically kind of stick with the same amount year round.
Listen, you have to know these higher levels that we take, they're way above the RDA. I mean, just so you know. I mean, I think if you're less than, what is it? Let's see if I can remember this. If you're less than 70, see, it's always the age groups I get mixed up. If you're less than 70, you're at 600 units a day.
Yes.
And if you're over 70, 800 units a day.
Yep.
I got to tell you, I think if you check those blood levels at those doses.
Well, let's clarify that, because those levels may, if you have a lab test, you'll be over 30 or so, and you will be likely within the range according to your lab
According
work.
to conventional numbers.
Just to clarify, the 60 to 80 nanograms per mil, these are more optimal blood levels. It's going to vary.
Yeah, it's levels that those of us who believe a lot more about vitamin D than maybe some conventional doctors do, we're the ones that like that higher level. They're going to want just that average range that you'll see on your blood. So again, to understand that, Life Extension has doctors standing by you can call. They can help you. They're not interpreting anything, but they can help you understand, are you within that optimal range that some of us like, or are you within just the normal range of conventional medicine? We got to move on and talk about other things. That was good, though. We needed to talk and clarify some of this up.
I think it's an important piece of the puzzle when it comes to seasonal affective disorder, but there are some other lifestyle things.
How about a light box therapy? What do you think about those?
I'm all for it. I've never lived in the northern hemisphere, but my family members, my sister, my brother, and I know firsthand how it can impact mood, and they've tried the light box, and it works.
Yeah, it works for them. Yeah, you got to make sure. I don't know what's out there. I'm sure you could go on Amazon or something and just search light box therapy, light boxes. I think this is the best advice we can give. You want to make sure whatever that box is, that it's generating at least 10,000. What do they call it? Lux of light, with as little of that being UV light as possible. That's I think that should be what you're looking for. Yeah. If you're, or of course talk to your own doctor, your therapist and stuff.
Yes. So and then 20 to 30 minutes.
Yeah, 20 to 30 minutes at a time.
But still wake up, open the curtains. You have to get some light into the home as well.
I love that in the morning.
Go outside.
Open up those curtains.
Go outdoors.
That sun's just coming. For me, the sun's just barely coming up. You see that beautiful light. Let that just...
Yeah, even if it's gray, it's still light.
It's still light. I know you can even just turn your bedroom light on, but I love that. I love that natural light.
Yes.
It's like so good. Yeah. And that helps the brain chemistry, and it sets you for the day. All that kind of stuff. Very important. We gotta mention. We just have to mention this.
We have to.
You go ahead.
Why not? Physical activity.
I know. We act like it's a word.
Your body. Move. Because people sometimes say, oh, here they are talking about exercise. We're not talking about exercise. We're just talking about movement.
Activity. Move. Whatever it is. Pickleball.
And if you can, do it outdoors. Now, I know that's difficult in the winter sometimes, but... bundle up,
get out
and get out there.
Or go to a gym, play basketball, shoot some hoops. I don't know, whatever you want to do. Get that physical activity because it is well established throughout multiple studies that physical activity improves mood disorders. That's all you gotta know. All right, so those are two things, light therapy. I was wondering, most of your family's from Georgia.
Yes.
Where's Georgia on that 30? Where are we at on that 34th? I think Georgia is a little above
I have
it.
no idea. Well, I think it depends on which part of Georgia you're in. You have northern Georgia, Atlanta. My family's south. Like
so they're
Savannah, Georgia.
So they're below. That's below. Okay.
Yeah.
Okay.
But I have family in Atlanta, which is northern Georgia.
Probably a little north.
Yeah.
Yeah. Okay. All right. I just
My
curious.
sister's in Tennessee.
Okay. Well, that's definitely north of the 34. Okay. Don't forget, we already said it. We don't need to dive into this anymore. Professional counseling. And number 2, if you need a prescription drug,
go for it.
Come on now.
Don't.
Come on now. Add vitamin D to it. Don't stop. Still do the vitamin D. But take your medicine, and if you are going to do that, please take it every day, as prescribed.
Yeah.
There you go. That's a good show. That was good.
Hopefully, we went off on some soapboxes,
it was good for me.
Tangents. But it's always, I love the friendly reminder about a simple nutrient that can help.
I know. It's so nice. So cheap. Cheap to test, cheap to take. Vitamin D. Come on now. If you want to learn more about what Dr. Crystal and I do, podcasts, live shows, blog, there's so much we have. There's a specific page at Life Extension you can go to. It's lifeextension.com/learn. Very simple. Go and learn. I learn stuff all the time on that page. It's fantastic. While you're at Life Extension, you can use the discount code
LE Live.
You almost said the other one. I saw it on your lips.
LE Live
for 10% off $50 or more plus free shipping and handling, because Life Extension wants to say thank you for being such a great audience. Don't forget, we go live every Wednesday at 12 noon Eastern Time. I'm Dr. Mike. That's
Dr. Crystal.
We'll see you next time.